Welcome to the program. We start from the county of Uasin Gishu in what has been bad happening for the counties in terms of health workers across the 47 counties following salary delays in some of them. Let's now take you to KTN's Mercy Kandie coming to you live from Uasin Gishu County.
Indeed, Ben, it's true that the medical practitioners in Uasin Gishu County and also Mombasa County heeded to the call of their union leaders, the Kenya National Union of Nurses, who called on August 1st for the boycott of services for those medical practitioners who had not been paid their salaries. And we look at these two counties, Mombasa County and Uasin Gishu County. Take a look at this story. The Coast General Hospital bears the brunt of the recent industrial action taken by health workers. Key hospital departments like the pharmacy, dental unit and theatre were rendered non-functional, and as is the norm, those who feel the pinch of it most are the patients, including the 320 inpatients, one in particular, a 3-day-old baby in need of urgent multiple surgeries due to body complications. The county government of Mombasa says it is negotiating with intern doctors who form the larger percentage of doctors within the county and have not been paid by the national government.
So far, Mombasa County has not received any money from the national government, including the conditional grant which was supposed to come for the first few months. So no money at all has come from the national government to provide salaries for the people at Mombasa. What you should understand is that it's not only the people who work in the health sector who've not been paid. Nobody who works for Mombasa County has been paid, including the governor himself.
Okay, like the dental, because their doctors were not there. So if we get the interns, we can open up the dental department.
Those who were at the medical center were at a go-slow, as many others didn't report to work. 4 deaths were recorded so far, though the county says it can't be linked to the strike. Admissions were reduced to 1 per day. That number is usually at over 40.
The county is working very hard to ensure that the people of Mombasa are paid latest this Friday. That is the resolution that we came up with.
In Uasin Gishu counties, the same situation replicated at the district hospital. Medical practitioners under the economic stimulus programs down their tools in salary arrears amounting to what they said was 3 months.
Continued harassment of health workers. We have also issues pertaining to remittance of our statutory deductions.
That there is nothing that actually can stop this county from employing them, other than only playing political games or rather gimmicks.
The 63 health workers under the economic stimulus program serve in other health facilities outside the town. The strike notice was issued on Friday, August 1st. The last time the nurses went on strike was on April this year. They then signed a return to work formula with the government, and currently they want the national and county government to not only make promises but act on what they say. The national government, however, through the Cabinet Secretary for Health, James Macharia, says the national government has dispatched money to the counties. Kenya Union of Nurses says it will on the 29th of this month meet KMPDU to issue a nationwide strike notice with regard to the health status in the country. Mercy Kandie, KTN, Eldoret, Uasin Gishu County. So that's the situation on the ground in Uasin Gishu County and Mombasa County, a sad state. And in the evening, we talked to the county executive in charge of health, Dr. Eunice Syria, here in Uasin Gishu County, and she requested the medical practitioners who had boycotted the services to come back to work, saying that by Wednesday, they'll all have their salaries in their accounts, saying that they also need to fill in the new evaluation forms which will be found within the county offices so that they can be evaluated and also be taken in on a permanent basis. But yes, that is the situation on the ground that needs to be, clearly looked into. I hand you now to Linda Ogutu in our Nairobi studios. Linda.